Welcome to the Metabolic Classroom. I'm Professor Benjamin Bikman, a biomedical scientist and professor of cell biology. For today's Metabolic Classroom lecture, we are stepping into the cold, or at least we are talking about it. Our focus is going to be cold therapy, and I'm going to take some time to highlight its remarkable effects on human health, with a particular focus, of course, on human metabolism. Now, when you think of cold, you might be thinking that it is something to avoid. After all, it can be quite uncomfortable. But metabolically speaking, it is a sufficiently powerful tool that you ought to be taking it seriously and perhaps not avoiding it too much. When the body starts to get cold, we're going to cover a lot of this in much more detail. There are some very metabolically relevant tissues that get activated. And there's also an endocrinology component to this, where there's a shift in hormones where it really starts to work in our favor. And with some cold exposure, you can also even have some dramatic improvements in insulin sensitivity and blood glucose control. Now, over the course of the lecture, we're going to explore how cold exposure can influence brown fat, how it affects shivering and why that's relevant, also the fascinating mechanisms of mitochondrial uncoupling, and then even some unexpected hormones that are coming from the muscle and fat tissue when you're cold, and then how all of this is also affected by the autonomic nervous system. We're going to talk more about all of this. So if you've ever wondered how something as simple and uncomfortable as being cold could be good for you and your metabolism, well, today's lecture is just for you. So the first part of the lecture today, I want to discuss brown fat. It really is like a metabolic revving of the engine. So let's begin with that. It is one of the more unknown and unappreciated aspects of human metabolism. And again, this is brown adipose tissue. Sometimes if you're reading about it in the literature, it will just be BAT or BAT, but it's just brown fat. Now, interestingly, it is in fact a rich reddish brown in color. It's so pigmented because of the high population of mitochondria that you find. The rich density of the mitochondria give it a distinct tissue that is very different from fat tissue that we store elsewhere, which is more white fat because of how little mitochondria, and indeed how little of everything there is except a big blob of fat. And thus that fat is very white. So we call it white adipose tissue. Now, unlike white fat, which is primarily designed to just store energy, store extra calories, and reflective of that, it has a very low metabolic rate. Brown fat really burns energy, it burns calories to generate heat. And it actually, and I can say this with some authority, having tested this in my lab, has a metabolic rate that is on par with muscle. The brown fat, as I noted, gets its distinct color because of how rich it is in mitochondria, the so-called powerhouses of the cell. And that gives it the distinct color, but it also gives it some metabolic oomph or power because within these mitochondria is a protein that makes it even more unique, which is a protein called uncoupling protein, or UCP1. Now, the name reflects the function. UCP1 actually allows the mitochondria to burn fuel like fats and glucose without being driven by the need for ATP. Now, as a brief little lesson in biochemistry, ATP is the cellular currency. It's always stated as such, and it's an apt metaphor where the cell needs to use something to buy an action. A muscle cell needs to contract, for example, or a nerve needs to send a signal along the length of the neuron. ATP is the molecule that allows this work to get done. So normally, a cell will think or determine, I need this much ATP, and the mitochondria will say, well, all right, I'm going to break down the fats and glucose enough to give you that much ATP. But in the case of the mitochondria in brown fat and the presence of UCP1, the mitochondria are breaking down the calories, like fats and glucose, to just create heat. It's like revving the engine of your car while it's still in park. So you're burning fuel, and the engine is working really hard. You see those RPMs really buzzing, and yet the speedometer shows that you're not going anywhere. So you're not getting any work done. That's what brown fat is doing. It's wasting energy, if you will, by design in order to simply generate heat. It is unlike, there's no other cell that is really, there's no other cell that's designed to act like this. This is mitochondrial uncoupling, where the mitochondria have uncoupled the electron transport system. To get very nitty gritty, the electron transport system is where the contents of breaking or burning glucose and fats come in. And then normally the electron transport system is going to be working just as busily as the last part, which is called oxidative phosphorylation, needs it to be in order to create ATP. And in an in an era where energy is in such excess, where people are eating all the time and indeed more than they need, this sort of energy wasting process can increase energy expenditure. So the body is burning more energy. This would be reflected as a higher metabolic rate. But naturally, as you go back to the engine and think about putting more fuel in the tank as you're sitting parked at the gas station, pressing down on the accelerator, you need to continue to put more fuel in the tank. In this case, it would be glucose, for example, and fats, but where glucose is getting burned, it helps the glucose levels in the blood be under better control. And if glucose levels are in a normal range, well, then so too will insulin generally. Now, why am I talking about brown fat? Because cold exposure is the primary trigger for the activation of brown adipose tissue. When your skin senses cold, your sympathetic nervous system, and we're going to talk more about this at the end, releases a hormone called norepinephrine. Now, in some parts of the world, it's going to be called noradrenaline. And then this little hormone will bind to receptors on your brown fat cells. And that's the green light to stimulate UCP1. That's what presses the accelerator, revving the engine, and now you're starting to generate more heat. But it doesn't end there. Before we move on from talking about fat tissue, even the lethargic white fat gets in on the action. When the body is exposed to cold, that same sympathetic nervous system stimulus that I just described that activated brown fat also starts to nudge white fat cells too, especially subcutaneous fat. I've talked about this abundantly in the past, but very, very briefly. When it comes to talking about white fat, the body will store that fat in two distinct spots. There's the subcutaneous fat, which is the fat that you can pinch and jiggle. But then there's also the visceral fat, the fat that is deeper, stored within the abdominal cavity, woven around your intestines and liver and kidneys and pancreas, etc. That white fat that is beneath the skin, the subcutaneous fat, has the potential, when sufficiently stimulated, like with the sympathetic nervous system, to start acting a little like brown fat. So these subcutaneous white fat cells can begin expressing genes typically found in brown fat, like very notably UCP1, that protein that's responsible for revving the engine but not going anywhere. Now, alongside this, you also have the activation of mitochondrial biogenesis. So the white fat actually starts to create new more mitochondria. So this starts to shift the behavior of the white fat. What was once a very low metabolic rate, high energy storage cell starts to become a higher metabolic rate, more of an energy burning fat cell. This transformation is pretty well documented, and in fact, to such a degree that it has been named Beiging. So that's a scientist's effort, not my own effort, mind you, to turn a color into a verb. So they're saying that you are beiging the white fat. So you're just turning the white adipose tissue into cells that are behaving a little more like brown fat. They're making more heat, or they're activating more thermogenesis. It's a bit like taking a slow idling engine and then just subtly pressing on the accelerator. While still in park, of course, you're not going anywhere, but now you are burning a little more fuel. And in the case of cold therapy, that a little extra burning can just help the body be a little more warmed up. Now, if you think about it for a moment, it's actually quite clever, because then subcutaneous white fat, the fat that is right beneath our skin, starts to act not only like a jacket, helping the heat stay in, because it is, after all, lining our bodies, but then it's also helping now, remarkably, generating its own heat. So it's like when you go skiing, and my family does that often, in addition, rather than just having a simple jacket on, you actually have one of those jackets that has these a battery, and it has wiring in it to heat itself. That's kind of what the white fat's starting to act a little bit like. Now, let's talk a little bit more about the mitochondrial coupling. In most cells, mitochondria operate very efficiently. So you have the electron transport system pumping out protons, and pardon me if we're getting a little too into biochemistry. It's pretty fascinating, and I don't think it's too complicated. So you have the electron transport system, which is pumping out protons out of the inner part of the mitochondria. And then as the protons want to start pushing back through, normally the part of oxidative phosphorylation that I described earlier, in other words, the part that's making ATP, it basically takes advantage of the protons that want to come back in. And it says, okay, proton, you can come back into the mitochondria, but I'm going to make you go through this kind of circuitous pathway in order to help me generate more ATP. But with uncoupling, it looks at all those protons that have been pumped out, and it says, hey, look, I'm not going to make you go through that tortuous pathway of generating new ATP. I'm just going to open a door and let you come back in. That's often called a proton leak, but it is just uncoupling. The reason I'm even bringing this up again is that it's a point of amusement for me when I hear supplements or ads where it's bragging about helping your mitochondria or your metabolism be more efficient, and then bragging about how it's going to help you lose weight. The irony in this is that, in fact, if you want something to help you lose weight, you want it to be inefficient. You want it to be less efficient. And in that regard, cold therapy is so effective at helping a person lose weight, because the inefficiency is a feature of this fat, of the way the fat is behaving, both by activating the brown fat and then making the white fat behave a little more like brown fat. It's a feature, not a bug. So when you're increasing the inefficiency of the mitochondria in the fat tissue, now you're allowing the mitochondria to just ramp up its metabolic rate and just be chewing through the glucose and the fats for no good reason. One view of metabolism is that you only burn what you need. So that's why people will say, well, eat less, exercise more, because if you exercise more, you're increasing the burning. Yeah, but what if you can increase some burning just because your body needs more heat because you exposed it to cold? Well, now you've introduced a new avenue that would have otherwise been untapped or not driven down. Okay, now let's leave fat behind and transition to talk about the muscle, because there is a very relevant muscle-driven metabolic component to cold exposure. Because during the process of the cold exposure, the muscle becomes very relevant, where if the stimulus is sufficient and it makes you cold enough, you're going to have the activation of something called shivering thermogenesis. So the twitching of the muscle. So shivering is an involuntary contraction of your skeletal muscle. That's just the muscle that you control, that moves you around. And while it's typically thought of as a short-term defense against cold, it is, and that's not wrong, although the short term can last for a couple hours, it is metabolically very important. Shivering is not like revving the engine in park. So that was the metaphor I used when describing uncoupling and mitochondria in the fat cells. When you're revving the engine, but you're not going anywhere. In this case, it's like you've shifted the car into drive, and now you are pressing and releasing the accelerator. You're doing a very kind of jerking motion forward on the accelerator where you're revving the engine and you're moving. You're getting some obvious action from it. So bringing this back to the muscle, in the case of the muscle tissue is rapidly contracting and relaxing. But that fact is, it's still you revving the engine. Now you're getting a little bit of work out of it. You are contracting and relaxing the muscle, But even still, all of the biochemistry that goes into telling the muscle to contract and relax, is generating heat. Because after all, every biochemical reaction will create some heat. So when your muscles are shivering, they behave kind of like how they do when you're exercising. This repeated cycle of contracting and relaxing is going to burn a lot of fuel, most especially glucose. The twitching, shivering muscle will be readily pulling in glucose. Now, something we'll come back to in a minute is that process, that shivering, those spasms also start to produce hormones. One very important hormone is a hormone called irisin. What's so remarkable about irisin that is released from the twitching muscle, the shivering muscle, is that it is a hormone that goes from the muscle to the fat and activates brown fat and stimulates some beiging of the fat. So it's turning on the thermogenic capacity of the fat. So it's a cool dynamic, isn't it? Where you're looking at normally thinking, okay, fat is getting activated with some mitochondrial uncoupling. Muscles getting activated through shivering. Both share a common stimulus, which is the cold. But then muscle has an ability to communicate directly with the fat, which is sort of the muscle's way of saying, hey, I'm shivering because the body's cold. I want to make sure you're helping too. And so I'm going to turn on your uncoupling. And irisin is going to be the signal. So it really is the muscle sending that message, hey, we need a little help. And it becomes a source of the signal. Now, once again, shivering improves insulin sensitivity and glucose uptake, just like how we saw the mitochondrial uncoupling in the fat tissue. But there's a new character here, which is once again an interesting instance of biochemistry, where the cold-induced shivering activates a protein within the muscle cells called AMPK. And when AMPK is activated, it activates in turn something called GLUT4. And GLUT4 is the doorway on muscle cells that will open up and allow the glucose to come in. So this is part of the biochemistry as to why shivering is so effective at controlling blood glucose, and it is. Again, it's just the muscle's way of just kicking open the doors for glucose to just come rushing in. Now, let's transition and talk a little bit more about hormones. You know enough by now about me to know of my affection for endocrinology and an appreciation for hormones. Hormones are such an overlooked important part, not just for human health, but especially for metabolism. It's sort of the way in which tissues are understanding the state of other tissues. You know, it's hormones allow the fat tissue to know when the body's exercising and when it's time for the muscle to be eating and the fat cell to not eat, but rather to share what it has. You know, think about that. Like, you know, how does fat tissue know when the body's exercising? Well, hormones. So these are the signals. How does the liver know when it's time to break down glucose rather than store it? Hormones. So hormones allow the distinct tissues of the body to just play as part of the grand orchestra and following the lead of the conductor. Now, I've already mentioned irisin, which is an interesting signal that originates in the muscle and then goes to the fat tissue to start enhancing its thermogenic capacity. But there's also another very relevant cold-induced hormone called fibroblast growth factor 21, FGF21. Interestingly, this hormone is released from both muscle and brown fat when the brown fat gets activated with some cold immersion. Regardless of the source, FGF21 starts to promote fatty acid oxidation, so it tells the signals of the body that are capable to switch over to fat burning. It also promotes substantial improvements in insulin sensitivity at tissues throughout the body, and no surprise, it activates some of the thermogenic genes like UCP1 and mitochondrial biogenesis in tissues like brown fat and even some white fat. Now, also on the fat side, the hormones that come from fat tissue are called adipokines. And earlier, I don't think I mentioned hormones that come from muscle are called myokines. Now, I'm old enough to remember a time when there were no identified hormones from muscle tissue. One of the funny quirks of endocrinology as a field is that if you looked at a textbook 50 years ago, you would only have primarily the canonical endocrine tissues. This is absolutely a tangent. It's just an interesting point for a professor who teaches endocrinology. You would have the thyroid gland, the adrenal gland, the pancreas, and the gonads, the ovaries and the testes, and that certainly the hypothalamus and the pituitary gland up in the brain. But nowadays, if you're really being thorough, you have to literally include every single tissue of the body. Skin is an endocrine gland. Your intestines are endocrine gland. The muscle, the fat tissue. In fact, realizing that fat tissue was an endocrine gland, that was a paper. I saw a paper in the late 90s. I think it was 1999. It was the first time I'd ever seen a paper that documented, that mentioned at all hormones that come from fat tissue. That was such a revelation to me that it literally gave birth to my interest in metabolism and put me on the path that I'm still on to this day. That may be part of my affection for endocrinology, because I owe the field a debt of gratitude for helping me, like I said, be on the pathway that I'm on today, which I find deeply gratifying. Anyway, so every tissue of the body is part of the endocrine system. So all of the canonical tissues have had to share the stage with a bunch of newcomers, like things as big as as fat tissue and muscle tissue. Okay, so that's a little bit on the hormones. But in fact, I think in the process of getting distracted, I didn't even describe the main adipokine that can also be released, which is adiponectin. So when the body experiences cold, of all the signals that are turned on, one of them is the fat cell releasing more adiponectin. And that's going to be a hormone that's coming from the white fat, particularly the subcutaneous fat. What's interesting about adiponectin from a metabolic standpoint is not only does it signal a very strong anti-inflammatory signal, but it also elicits a significant improvement in insulin sensitivity, thereby helping maintain ideal glucose levels and, of course, improving overall health as insulin is under better control. Now, altogether, including other hormones, but at least these hormone signals that I described really help kind of reshape and determine the metabolic response to cold immersion, like a higher energy expenditure, better blood sugar control, and, of course, improved insulin sensitivity. Now, throughout the conversation, I've been talking about glucose control, and I just want to really emphasize that fact that there are multiple mechanisms that suggest how cold therapy can be so therapeutic for people who struggle with glucose control. So again, just to recapture them, we have the activation of mitochondrial uncoupling in brown fat and in white fat, that process of beiging the white fat. We have the shivering and how the shivering-induced contractions greedily pull in glucose. And then we have just the general enhanced metabolic rate throughout the body because of the cold exposure, and the glucose will fuel some of that. What's important is that based on several reports, even a little bit of cold exposure, just either being in a colder office where you're shivering a little bit, or some more dramatic interventions, which I'll get to in a minute, there's substantial evidence to show an improvement in glucose control and insulin resistance in pre-diabetics and even in type 2 diabetics. Of course, as I'll get to, the effects are all the more dramatic as the cold exposure is more dramatic, but we'll get to those interventions in just a moment. Before I do so, I wanted to just revisit the nervous system. There's a fascinating dynamic of the nervous system. And my friend and fellow professor, and in this case, entrepreneur, Dr. Thomas Seeger, Seager, he's one of the people I've first heard elaborate on the nervous system regulation in the context of cold. Now, as a professor of physiology, I've long been familiar with the branches of the nervous system, including the autonomic nervous system. But I encourage you to look up the work of Tom Seeger if you want to learn a little more. Now, I'll mention him again in a minute, I think. Within the nervous system, among the several branches, the autonomic nervous system is so important because of its two famous sub-branches. where we have the sympathetic nervous system and the parasympathetic nervous system. Now, if those terms don't sound familiar, their nicknames will. The sympathetic nervous system is often just referred to as the fight or flight branch. And then the parasympathetic is referred to as the rest and digest part of it. Now, when it comes to the cold therapy and the sympathetic nervous system, you have that hormone I mentioned earlier, like norepinephrine or noradrenaline, but you also have some others like just epinephrine. But that is what's constituting so many of the important effects that we see here, like enhanced, like the heart rate going up, metabolic rate going up, fat breakdown, like lipolysis, more fat burning. All of those are consequences of activating the sympathetic nervous system. But interestingly, with regular cold exposure, the evidence suggests that you actually start to balance things out, where you can see an improvement in a marker of parasympathetic activity. Namely, you've probably heard of this, heart rate variability. That's a marker of parasympathetic tone or function. So in other words, controlled and frequent cold exposure can help the body better shift between the kind of stress state, like the sympathetic fight or flight, which isn't bad. You want to have that turned on sometimes, but then also the parasympathetic recovery state. So the collective outcome of this could be something that we could call like a nervous system resilience or flexibility, the ability to quickly and readily go between the two. Now, before we wrap up, I just want to compare some of the cold exposure methods. So let's get a little practical. If after hearing all of this, you've been convinced that you need to find a way to incorporate some cold in your life, you want to know, well, which method is going to give me the best effect? Now, I'm going to go in order of the best effect, but there's also something to be said for ease, which I totally get. I totally understand that. So the first one is just immersing your face in something cold. So dunking your face in cold water will trigger something called the mammalian dive reflex. This is going to actually slow heart rate and activate the parasympathetic tone of the autonomic nervous system. It has been suggested to be a good way to manage anxiety and to calm the nervous system, but in the context of the broader metabolic effects that I've been talking about, it's not really going to move the needle. Now, what will move the needle a little more is getting that cold water on your body through something like a cold shower. Now, cold showers aren't the coverage isn't enough, and usually it's too short that you'll get a little more of a metabolic effect, but it's not going to last. Although it can be very good for mood and mental resilience, just doing something hard. But again, the metabolic benefits will be somewhat limited. Now, what if you're just going outside in the cold? Well, if you're out long enough that you start shivering, then you're going to be doing something. But that's going to take a little longer. It's subtle. It's slower compared to some of the more intense methods, which I'll get to. But it's also easy. Now, cryotherapy, that is more complicated, maybe more complicated than all of them, because you have to go into a cryotherapy chamber. They're very flashy, but they're functional. But basically, you're getting blasted with like liquid nitrogen cooled air. Now, unfortunately, it doesn't really penetrate into the body. So that's a very expensive, complicated process that no one has in their own home. You can only get that by going to some facility. And the effect kind of balanced out with that somewhat cumbersome arrangement and technical devices and intervention to make sure you're not causing some kind of like freezer burn. You are going to get more of a metabolic effect, but it comes with a pretty high cost. Now, where I think the absolute best effect is, it's water immersion. That is the gold standard. Water will pull heat from the body 25 times faster than air will. And so with full immersion up to the neck, especially if the water is below 50 degrees Fahrenheit or below 10 degrees Celsius, so this can get to the, with some of the cold baths, you can get into the mid 30s and have it make your own ice. In fact, there's only one that I know of, and indeed it's the one that I use. So I don't get any, I have no vested interest in this, but the Morozka Forge, Morozko, the Morozka Forge is, in my opinion, the absolute best. And that guy I mentioned earlier, Tom Seeger, that's his brainchild. It is, for reasons he can elaborate, I invite you to go look up his details. They're some of the best In fact, I believe the best single ice bath out there. Because the cold exposure is so thorough with just full body immersion, the brown fat activation is substantial. The norepinephrine release is robust, including other hormones like dopamine, enhanced glucose uptake, the mitochondrial uncoupling, the shivering. When I get out of my ice bath, having been in it for about 3 to 5 minutes, I do it at about 40 degrees. So I'm a little bit of a wuss in that regard. I can be shivering for up to 2 to 3 hours after. That's even after drinking some warm tea. So that is a metabolic effect that is clearly lingering as my body continues to just warm itself back up. So to sum it all up, cold exposure will absolutely engage the body in what we could call a very coordinated physiological response. We have the activation of brown fat. We have the somewhat subtle conversion of white fat to beige fat. We have shivering of the muscles, all of the mitochondrial uncoupling in those fat cells, the hormones that work in our favor, and then just a little bit of mental resilience. So, if you're looking for a bit of an advantage and you've already been adopting some of the dietary changes, which are so important, absolutely a natural, accessible, very scientifically supported way to give yourself a little bit of a metabolic boost is something like cold therapy, water being the best of all. I hope you feel like you've learned something fascinating and relevant and helpful. Until next time, more knowledge, better health.